Please welcome Sheryl Crow. Thank you very much. Come have a seat.
Love the t-shirts.
Aren't they cool? We're going to talk about
Yes.
those t-shirts in a second.
Yeah, right.
So first, I want to talk about the life journey that breast cancer took you through. So let's start with that moment that you first heard the word cancer. What were you feeling?
Well, no one ever expects to hear that, for one thing, and particularly if you're healthy. And I was always very fit and was pretty conscious about what I ate, although I did eat some Fritos now and again and some powdered sugar donuts. But, you know, I was pretty healthy, and it was very unexpected for me, particularly because it was just a very routine mammogram and calcifications, which many people have, but at which point they start to have an abnormal look to them. Then there's some concern. And when I had my mammogram, they said, let's keep an eye on him and come back in 6 months. And it was my gynecologist who called and said, you know, my mother's going through breast cancer treatment. Let's don't wait 6 months. Let's just look into this. So.
And you were 44 years old, right?
44.
So, I mean, how'd you face the darkness, the fear that happens when you're that young age, unexpected, you've done everything right except for a few donuts?
Yeah.
Yeah.
It's like anything in life where, you know, you have those sort of standstill moments that really grab your attention. And it wasn't just the breast cancer diagnosis, it was everything that was going on in my life. And catastrophic moments don't pick their timing according to how much you can handle. Yeah. You know, oftentimes when everything is really piling up, that's when these moments will grab your attention and really help you to prioritize what your life is meant to be about. And that's what my cancer diagnosis did. And then, you know, ultimately, although I would never have chosen to be a spokesperson for the breast cancer community, because God knows there are some amazing people out there that give such a bright and shining and heroic face to cancer, I happen to have an incredible fan base of women who are young and who are my age, young, and older. And so I get the opportunity to tell women to know your family history and to understand and recognize the terrain of your breast.
Did you have family history, by the way?
I had no family history, and the other, you know, the third part is to be diligent about your mammograms.
Yeah. I'm going to point this out because Sheryl mentions it, and it's important for us all to get straight. Only 20% of women who get breast cancer have a family history. So the fact that you don't have a family history doesn't mean that you're safe to go. And the fact that you got that mammogram early on, we'll come back to over and over again.
Yeah.
Well, one of the people who helped you get through this is a female, Kristi Funk, who's joining us.
Yes.
That happens to be your oncologist.
Oh, there you are! Oh, my God! I'm looking at all these pink t-shirts, and I didn't even look at you yet.
So, Dr. Funk, walk us through some of the numbers on early detection, what works, and what are the statistics around why they work.
Absolutely. So when we say early detection, we mean finding breast cancer at a curable stage, stage 0 or 1. These two types of cancers are 98% curable. And the best way to find an early stage cancer is through mammography. Mammograms have been proven time and time again to decrease the death rate from breast cancer by somewhere between 15 and 60%, with the average of studies showing about a 30% decrease in death. So to skip that mammogram, not to be too dramatic, it can be the difference between life and death. Is that too dramatic?
No,
it's true,
it's pretty
though.
accurate.
It is very accurate. And if you look at advanced stage, sadly incurable breast cancer patients, 50% of them did not have a mammogram in the prior 2 years.
So, Sheryl, we've actually surrounded Dr. Funk with some beautiful women, all dressed in pink for a reason. They're our fellow survivors.